Well, good morning. This is a continuation, or we're coming out of recess from our morning session and forming as the Board of Health for our quarterly Board of Health update. Amanda, could you call the roll, please?
Commissioner Thayer?
Here.
Commissioner Richardson?
Here.
Commissioner Schroeder?
Here.
Alrighty, we have a quorum. So, Dwayne, welcome.
Good afternoon, good morning, commissioners and citizens listening in and folks attending. I'm Dwayne Smith, Public Health Director, here to give you the quarterly update, which will be kind of a combination review of 2023 / quarterly progress in Q4 of 2023. You can see our agenda. We'll start off with the clinic updates.
Put that mic closer. I'm having trouble hearing you.
How's this? Okay. We'll start off with clinical updates, and generally Q4 was slightly busier in patients and revenue than Q3. And all this data is self-explanatory, so I won't read through it. Our clinic revenue, this is a look. We did get in the good graces of Anthem for credentialing, so we've begun billing them. We've got, and I asked this question about why the claims were denied for TRICARE, and honestly, I can't remember the answer. I believe it was an administrative issue. So, year-to-date revenue, I'll call your attention to not quite $16,000. When we did the 2023 budget, we had to plug in a number for revenue, anticipated revenue for the clinic. It was really a shot in the dark. I put $50,000. So we certainly fell short of that. But if you look at the next slide, as long as we can continue increasing quarter over quarter, I'm okay with that.
On the previous, the slide with just the clinic revenue by the billing party, it might be interesting if you could have what number of people were served. I mean, was that? I'm curious.
By insurance carrier?
Yeah.
Yep. Okay. Good suggestion. Yep.
TRICARE had one claim only, and it was denied, or we've had 12, and that's a significant revenue we might have missed out on.
I know we looked at that when we ran a preliminary report. So the electronic health record platform allows us to run those types of reports. If I'm not mistaken, Medicaid, Medicare is our largest, most frequently billed per client. Again, consistent with our median age in the county skewing older, more folks Medicare than Medicaid.
Thanks.
There's our environmental health updates. Of note, our revenue of $135,000 was down significantly in 2023. Typically, it's in the $160,000, $165,000 range. Two factors that we can identify as a result of that. One is the weather from June and July and the associated flooding and whatnot. And two are interest rates for mortgages and refinances or home improvement loans and things like that. So that has probably more dramatically impacted the numbers where people may have had the money squirreled away to do an addition or an accessory dwelling unit 12 months ago. Interest rates, loan rates went up, and they quickly found out that the $20,000 they had budgeted turned into $30,000 or something like that. So there's our inspections, again, slightly down for the aforementioned reasons. and you can see our revenue comparisons year over year. Our vital records, our birth certificates and death certificates, the state has transitioned to a new system, Colorado Vital Event System. We have completed the required training and are now operational. And just as a reminder, birth certificates for the first one and death certificates also, $20 for the first one, $13 for each additional certification for the same record. If we need to do some searching for an unknown date of death or date of birth or things like that, if folks want a historical record, there may be nominal additional fees. And for folks that are calling out of the region or requesting from out of the region or out of state, we can ship them via secure FedEx or UPS for that $30 charge, so they don't have to drive to Kiowa. Eventually, our volume of vital records will level off, hopefully at a high level, but there's only going to be so many people born and so many people that are going to die in the county. So, but as yet, we're continuing with an increase in the number of records issued. And we make a nominal bit of revenue, certainly enough to cover the time spent by staff. Transitioning to health promotion. So the WIC program we have suspended for the time being. That was suspended probably in October, I would think. A couple reasons for that. Again, we are partnering with Douglas County Health Department. They had, I believe, all but 2 of their WIC staff depart the health department. So I know at one point they had 3 or 4 vacancies out of a staff of 5 or 6. And coupled with the low uptake or response from Elbert County folks, it was a staffing issue and an interest issue. So we still are not able to demonstrate proof of concept, if you will, proof of need for WIC. However, I will say that we know that there are probably in the neighborhood of 175 to 200 families residing in the county that are eligible for WIC. We are continuing to effort to communicate the availability of WIC. Elbert County residents can still make an appointment with Douglas County and go to Castle Rock to receive WIC benefits and get enrolled and things like that.
Tell us what WIC is.
WIC is the Women, Infants, and Children's Program. So it focuses on pregnant moms and children up to age 3, if I'm not misquoting that, and make sure that they're thriving, that they have the resources that they need. It provides diapers, provides nutritional counseling, breastfeeding support, and things like that. So it's a core public health function across every health department in the country. The Tobacco Education and Prevention Program, again, is a partnership with Douglas County Health Department. Their tobacco educator, Jenny Fisher, will be hitting the ground in Elbert County this quarter with schools and other community entities. The focus is on prevention of youth using tobacco. But there's also a component of folks, adults that may have been years-long tobacco users, making sure that they're aware of the resources like the Quit line that they can access to help them curb an unhealthy habit and hopefully cease using tobacco. We're continuing to publish the weekly updates, continuing to promote programs and services through a periodic, I won't say weekly, column in Ranchland News. And we had our quarterly blood drive in November, I believe. And we will continue those, everything you see here through 2024. It's a new year. For our emergency preparedness, again, this is our new hire, Juliet Madsen, an Emergency Support Function 8, which focuses on public health and medical services. She's begun her work. She's hit the ground running and is getting trained up and making connections, not only within the county, but also with their counterparts in other counties to see how other folks are doing it, so we don't have to build everything from scratch. Juliet is available to come conduct trainings around stress, trauma, resilience for any community group or organization. Her email and phone number are on this slide and also on our website, on the public health page on the county website. So we're excited and fortunate to have an ARPA grant to support our public health functions and department. Not sure if you're aware of, you probably are, at the national level, the kind of bottleneck with ARPA. So we were probably first put on notice sometime last fall, and it was kind of this money's coming, this money's coming. Not pointing fingers at anyone. We got notice probably mid-December, maybe late December, that the funds were green-lighted back to December 1st. So any expenses incurred from December 1st, we can include moving forward. We have to have the money spent by June 30th. We have submitted a budget to the state. We are awaiting approval. One of the things that I'm just going to highlight a couple things here in the bulleted points. So we're going to buy clinic supplies. We are going to buy, or we have asked for permission to purchase, an EKG machine. That is a result of, there was a patient that came to the clinic maybe 3 weeks ago that was decompensating and had low oxygen saturation. Long story short, our nurse ended up calling Kiowa Fire Rescue. The patient necessitated transport to an acute care facility. So in order to be more prepared next time, it would have been helpful if she had had an EKG machine where she could hook up the leads and see what was going on a little bit more acutely. As long as they approve it, we'll get one of those and just be better prepared in the event that someone may be experiencing a cardiac episode and thinks it's not bad and comes to our clinic and we find out it is bad, and then she can take the appropriate actions and also call 911 and get the emergency transport to an acute care facility. So
that's in addition to what's on this list, or is that incorporated into?
I am including that under clinic supplies.
Okay. All right.
I probably should say equipment. Stacy in environmental health could use, it's very needed, a laser measurer these days with all the inspections she's doing rather than rolling out the tape measure. A trailer for public health emergency preparedness and generator that will support county functions across the emergency management and response spectrum. And then I want to mention behavioral health. So you'll recall that in 2022, when we did our community health assessment, the 3 health Priorities identified by the respondents were access to care, behavioral health, and healthy aging. Within the space of behavioral health, in a perfect situation, if we had, $250,000, we might look at hiring a practitioner to help with kind of the backlog in need for assessment, counseling, therapy, things like that. That's a big lift and a big expense. There is a way that we can dip our toes, so to speak, into the space of behavioral health promotion without committing as much money, and that's through a platform called Credible Mind. It is crediblemindcom, I believe, online. And this is a platform for the public to use. They can use in the privacy of their own home. It's designed for ages 13 and above, and it's designed to empower people to take an active role in their behavioral health. There are 20 different assessments that folks can take to assess their well-being. They can use it anonymously, or if they choose, it can be tied to their medical record for their primary care provider or their behavioral health specialist or whatever. Our initial costs would be a $500 setup fee and then an annual contract fee of $6,210 for a first year cost of $6,710. So we put that into the budget for ARPA, this ARPA grant. Couple things I like about it. It is endorsed by NACCHO, the National Association of City and County Health Officials. It is being used by health departments around the country. And while I'm not at liberty to say, because they haven't signed their contracts yet, there are a couple other health departments in Colorado that are either close to signing a contract or have signed a contract, including one in a neighboring county that I'm not going to name. So this allows us, again, to assess and hopefully demonstrate proof of need for, let's just say, 2 years. We had this. We're talking about, $13,000, $14,000 over 2 years to identify whether or not this is something that can be used. Let's say, conversely, if after 2 years we look at the analytics and say only 100 people, ever use this, then all we're out is, $13,000 as opposed to paying a therapist $100, $125 an hour and maybe not having a full calendar. More to come on this, but I just wanted to tee that up, and hopefully we'll be getting notification from the state on approval of our budget submitted, and then I can share more at the next quarterly update. So this is a good segue to the behavioral health assessment. And this was the main focus of what I wanted to share. We contracted with a consultant. This consultant has a PhD in epidemiology. She has a master's of public health. She is adjunct faculty at CU Denver and Metro State. She completed the literature review, looked at the secondary data sources that you see noted there, conducted 12 key informant interviews with representatives of 10 agencies in the community, some governmental, some non-governmental. We did the community survey. We have a challenge in the county with folks completing surveys. That's nothing new to y'all. 114 were completed, 108 were used. The 6 that were not used were kicked out. They were not county residents. So we wanted to be able to say county residents said this. So, as you would expect, the assessment found that there's not enough behavioral health providers and treatment services available in the county. There remains significant stigma in the county surrounding mental health struggles and seeking treatment. And a little bit surprising, but certainly noteworthy and something we can work on. County residents are generally unaware of the existing services and resources. So, with that in mind, the recommendations were to, work with partners across the county and the state to attract more providers to the county, to incentivize them to come here and work, to work with partners to build and implement a community health response team. So this would be, the example I typically cite is Colorado Springs Fire Department. They have a behavioral health counselor that rides with them on their EMS runs when there is a call for, or a behavioral health related call. So that's a much bigger lift. That would necessitate some grant funding, but there is funding out there available for those types of programs. And this would be, for example, a partnership with Elizabeth Fire Rescue or another first responder who make a significant percentage of their calls on behavioral health runs. Another recommendation is to increase awareness and focus on reducing the stigma. We're not going to flip the switch overnight, but we're trying, we have been regularly communicating that in the same fashion that you want to take care of your physical health, we need to take care of our mental health. And that's a challenge in rural communities. It's not specific to Elbert County. It's not specific to Colorado. And also work with partners to promote primary prevention among young people regarding shared risk and protective factors. Continuing with the recommendations, promoting primary prevention, that's a duplicate. So scratch that. And then working with the veterans community to look at VA-supported approaches to increasing access to services, specifically for veterans.
I could add a potential source. If you'd reach out to Farm Bureau in Colorado, they've been supporting some pretty innovative approaches to mental health support to ranchers and farmers directly in the rural areas, and trying to address it in a way that reduces stigma and has more quiet access to support.
Definitely, wholeheartedly agree with that. We did, one of our communications last week focused on the agri-stress program that is very similar. That is, I can't think of the national nonprofit offhand that runs it, but it is a behavioral health resource that farmers and ranchers can call and talk to someone who works in an agricultural family or an agricultural role that has been specifically trained to have those conversations that are the types of issues that are stressing farmers and ranchers, whether it's weather and commodities prices and, relationships and all those other things. So definitely a significant component of what we're going to do moving forward. Thanks. Any assessment is not without its limitations. So we are continually challenged, as are a lot of eastern Colorado counties, on having enough data points. So some of our secondary data is grouped among several eastern Colorado counties. Again, our community survey had low participation, so It is therefore a convenient sample of the folks that responded and not necessarily representative of the thoughts or will of the county as a whole. We had initially intended to have a separate survey on the younger population in the county. Given some hiccups with the Healthy Kids Colorado survey and some other things, I felt like it was a better idea to hold off on that. And we also want to be understanding and trying to find the right balance. You know, we do a lot of surveys. We ask the community to do a lot of surveys in a lot of our departments, whether it's extension or public health or, you know, the water survey or whatever. Folks that answer the surveys, respond to the surveys, are typically the folks that are more engaged. In a perfect world, we'd have the resources to have more feet on the ground and doing more focus groups and things like that. So it's not perfect. And our list of community assets may be incomplete, is kind of a general disclaimer. Similar to the community health assessment, we'll be posting the behavioral health assessment on the public health page of the county website. There is a one-page executive summary. Probably, I think last week I sent that to y'all, the executive summary and the full report. The full report does include an appendix for the community survey that was included. Okay, I'm excited to announce me putting my money where my mouth is. So, rural communities are challenged across Colorado with recruiting and retaining and training folks for teacher roles, for public health, for nursing roles. So I figured the least I could do is to try to help defray the cost of getting educated and trained in those disciplines, specifically public health and nursing. So working with the Elbert County Foundation and former Commissioner Pettit and their other board members, probably in February, we're going to launch the scholarship opportunity for a graduating senior from an Elbert County high school that plans to study public health or nursing this fall. They'll need to answer 3 essay questions and give us their thoughts. And I'm going to tell you what the essay questions are. First one is, what do you plan to contribute to the field of public health or nursing in your future career? Second one is, what do you believe to be the biggest issue that is currently impacting healthcare or public health? And third, what role do you think public health plays in the future of the healthcare industry? We'll work with the foundation and the board to review the applications. I will write a check to the foundation to fund this, and applications will be due on April 15th. So I would be remiss if I didn't share that folks are welcome and encouraged to contribute to the scholarship fund to increase the value of the award. So hopefully this is just the seed that helps this fund grow. So,
well, thank you for establishing this and the personal commitment to establishing it.
the cost of education these days, I've got a daughter that's a freshman in college, and you know, it's not cheap. $500 hopefully will at least buy books for a semester, textbooks. So
I share your pain. Thank you.
Want to remind folks, if they need to report a public health concern, and that they can do so. We ideally like them to fill out the form. If for whatever reason they're not comfortable doing so, we can take the information, but it's more complete if we have the form and as much information as they can share. I want to back up. There was a late-breaking notification we had this morning. We are kind of in wait-and-see mode right now. We were notified by Douglas County Health Department of a whooping cough case at a local school. We have been in contact with the school nurse. The school nurse is working on a notification to the parents. There was a child with an infectious case of pertussis, which is whooping cough, that was in school the last couple days. Again, we just were notified of it this morning, but I bring that up to share with the community. If your child is sick or exhibiting symptoms, cold-like symptoms like a runny nose, mild coughing, a low-grade fever, symptoms will appear 7 to 10 days after being in close contact with someone that has whooping cough, but it can take anywhere from 4 to 21 days. So just sharing that parents should be on the alert for the next 10 days-ish. And also, it's important to mention that whooping cough is a vaccine-preventable disease, vaccine-preventable infection. So our health department participates in the Vaccines for Children's program. Families can get the vaccines free of cost for your typical measles, mumps, rubella, pertussis, all those things. So there's my contact information. Please connect with us. And in wrapping up, we are a resource for the county. So please take advantage of the resources that your local public health agency has to offer. So,
Thank you. Got any questions for?
I didn't want to interrupt as you were presenting, so I've made just a couple notes here. Back to the slide on the ARPA grant to support public health. The supplies like the EKG machine, that becomes property of Elbert County Public Health.
Correct.
At that point. And then, if I remember right, there's several positions that are also either wholly or in part funded through grant process, and
Correct.
Those are going to have a sunset somewhere in the future. Are those positions specialty positions that would require to be using equipment like this? Or how is that going to look going forward, I guess is where I'm getting with that.
Yeah, good questions. So specific to the trailer, the generator, that is for the Public Health Emergency Preparedness Coordinator. We're trying to build out her supply of things, and it's literally everything from if we had to buy hard hats, if we were to do a water distribution, protocol dictates that not only for awareness purposes, like this is a person with a vest on and a hard hat, that's where you're going to get your water. Trash bags, if we had a sheltering event, whether it was weather-related or fire-related or something like that. So we need to stock up all those types of supplies, and the trailer will help with that if we had to, transport cots, many cases of water, and particularly in the event of a storm-related event, we may need a generator for folks' medical equipment or things like that. So, yep, everything we buy will remain with the county. Some of the supplies, obviously, we'd expend those over time. This award supplements those so that hopefully we don't, we'll spend this money first before we spend, kind of county budgeted money. So, same with some of the environmental health equipment. That helps Stacy do a more efficient job. So if you can point a laser measure and get a measurement on a septic tank in, 10 seconds, as opposed to unfurling, a 100-foot tape measure, she can do more inspections. So does that help? Any other specific questions on those?
And also then those positions that are grant funded, so where, going forward, what the plan is on those specific positions?
Yeah, so the nurse practitioners, they are grant funded. We are good through 2026 on that. The thinking all along with that is demonstrating proof of need, coupled with billing insurance. All we have to do is break even on their salaries. Hopefully we make, revenue above and beyond our expenses, and we can, be more self-sustaining. So we've got, 3 years, 24, 25, 26, to generate the revenue for their salaries. And this was a down year for environmental health revenue. That's directly tied to, septic inspections and things like that. We have always generated more revenue on the environmental health programs than our expenses in personnel and, other nominal costs. So let's say if we typically generate $160,000, $170,000 in revenue for environmental health, and our costs are $120,000-ish, that extra $40,000 we can repurpose to other health department programs. So while there is a sunset to the nurse practitioners, the emergency preparedness coordinator, the finance and grant specialist, we are healthy with our fund balance. We are, I'll just say, optimistic that we'll be able to generate revenue to support those programs in perpetuity, barring any unforeseen, craziness.
Okay, I appreciate that. And then the last question that I have, in response to the behavioral health, partnering with across the county and state, is that just with other agencies and organizations, or does that include private organizations and individuals, or is it just with public-facing entities?
So we are open to any and all partnerships, both in the public sector and the private sector. When I say partnerships in the public sector, that is the Behavioral Health Administration. That is the Office of Suicide Prevention at CDPHE. There are many 501c3 nonprofit entities that have resources that we can refer to and tap into. It's Colorado Access with regard to making sure youth have coverage so that they can get behavioral health resources, an appointment to see a behavioral health provider. So it is everyone that is working in the space of behavioral health, and it's important to note that an easy perception is, well, we have Centennial Mental Health here. They do behavioral health. They're not staffed to meet the need. It's not the sole purview or responsibility of Centennial Mental Health to solve the behavioral health issues of an entire county, and they serve 10 counties. Even though they have a presence in every county, they're throughout Northeast Colorado. So I am of the opinion and the approach that it is incumbent upon everybody that has a role in behavioral health to play their part. So so that it doesn't fall disproportionately on the shoulders of one entity. And that's kind of how we got here in the first place. Everybody's like, oh, no, that's not my lane. Well, it is.
I appreciate that and the idea of referring, if we're not able to do a service for somebody, to be able to refer either to more of a public agency or to a private practice or individual, I think is beneficial. So I do appreciate that.
Sure. On that note, our nurse practitioners are screening for behavioral health conditions when they see anyone in the clinic. So that's one part of that, initial conversation you're having with your provider when you're first starting that appointment. So if they identify anything, they'll dig a little deeper and identify any potential resources or needs and can certainly refer to specialists. So we are universally screening everyone that comes in.
Just a little off that track, but same slide, just for the generator and trailer, when that comes to pass, if just coordinate with Mike Moore, so
Yep, definitely.
that we definitely have tires and brakes and periodic services for equipment like that. It's not accumulating outside his view, so,
Certainly.
okay, thanks.
Your comment on that trailer is also an interesting one. How does that fit with OEM?
If there were an incident that necessitated deployment of resources, probably better than 9 times out of 10, Shane and OEM is going to be the lead. So emergency support function 8 for public health, that is specific to, well, COVID is the easy example. We would be the lead on, communicable disease outbreak or something like that. Most everything else is going to be, we're taking direction from Shane. So, yep, coordinating, taking direction. In the event that the EOC is open, I will be there on the public health desk.
Alrighty. No, I appreciate the time. Thank you very much. And I think Sean had talked to you, or trying to work around your phone calls, but if, I think we were looking at trying next quarter to do this at 9, tee it up at 9, so then we can roll through the whole morning without recesses.
Not a problem.
Folks that are trying to attend aren't stuck here all morning. Thank you.
Thank you.
Not stuck. They have the privilege of being here all morning. The pleasure. It is the people's building. Thank you. So it's 9:43. We're in recess and we'll reconvene at 1 p.m. at this location for land use. It's 11:43. Thank you.